we can appreciate that the algorithm has a rather remarkably strong ability to predict with an area under the curve of 0.85. So now an even higher C statistic with a validation of identical strength of 0.86 in Hamburg. What this means is, depending on how you partition the score, once again, green, yellow, red, if you wish, you can identify individuals with a very low likelihood for obstruction, around 90% negative predictive value, but importantly, also folks with a very high likelihood for obstructive CAD. Furthermore, lending not only, I think, nice data validation of the strategy, but really sort of showing how biological measures actually line up quite nicely with the clinical reality that we see. Depending on the categorical score, what you see is on the x-axis, the score from 1 to 5. On the y-axis is the maximum coronary artery stenosis in the coronary vessels. As the score goes up, the average coronary stenosis rises in a stepwise fashion, really providing, I think, rather nice confirmatory evidence that the score works not only as a dichotomous yes/no, but also gives you a sense of where a patient is on the playing field, if you will, if they have an intermediate score. And a question that comes up, of course, is, how does this do with relative to other markers? I've already mentioned that troponin alone ain't going to cut it. On the upper right is our internal validation. On the bottom is Hamburg's validation. Just once again showing repeatedly just how strong the panel performs. Notably, in Hamburg, they had patients with acute chest pain. And what's interesting there is that in individuals where the troponin was somewhat ambiguous, the other two markers help to pull individuals up to high sensitivity and specificity for the presence of an obstructed coronary vessel, suggesting that the panel could not only be used in more chronic ambulatory situations, but also in acute chest pain situations. So much like the CVE score, so depending on how the score falls, Prevencio actually does a very nice job of also, once again, giving you the green, yellow, red approach, which imparts not only an understanding of where the risk is, but how high the risk is. And then again, informs the different proteins that are abnormal in the panel. This one's a little bit easier to explain when a clinician says, well, what do you do if you know that your patient has an obstructed coronary? Well, that's a pretty easy answer. What about those individuals with intermediate scores? There's a unique opportunity to intervene, lay on extra secondary prevention. On the other hand, those with a low risk finding, again, we would still remain very much in the prevention posture, but with a different strategy with respect to how aggressive one might get with respect to other approaches. Now, as I said, I measure both CVE and CADhs when I've done it. The idea being that you get form and function, which provides a unique opportunity not only to understand the biological underpinnings, but then also with respect to the risk associated with whatever atherosclerosis may be present. And once again, much like with the CVE panel, Prevencio has done a nice job of summarizing things for clinicians, as is seen on the next slide, as well as for patients, with a trifold also for patients to understand why you might be interested in measuring this.